Hyperthyroidism, or an overactive thyroid. It occurs when your thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can accelerate your body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. Graves' disease is an immune system disorder, and it results in the overproduction of thyroid hormones, which causes hyperthyroidism. Although a number of disorders can result in hyperthyroidism, Graves' disease is a common cause. Thyroid hormones affect many body systems, so signs and symptoms of Graves' disease can be wide-ranging. Some research suggests that selenium can be used to treat the symptoms of hyperthyroidism. Selenium is a mineral that naturally occurs in water, soil, and food, like nuts, fish, beef, and grains. In Graves' disease, selenium supplementation might lead to faster remission of the hyperthyroidism and improve the quality of life and eye involvement in patients with mild thyroid eye disease. The thyroid gland has the highest selenium concentration per unit weight among all tissues. Selenium is incorporated into key enzymes involved in several metabolic pathways. One way to get selenium is to eat 3 Brazil nuts per day. Observational studies have found low levels of vitamin D in patients with both hypothyroidism, which is the underactive thyroid, as well as in hyperthyroidism, which is the overactive thyroid. You can get a 25-hydroxy vitamin D blood test and then take vitamin D3 accordingly to correct any deficiency. Test tube studies have found that lemon balm blocks the attachment of antibodies to thyroid cells that cause Graves' disease. The brain signal to the thyroid is also blocked from further stimulating the excessively active thyroid gland in this disease. In vitro and rat studies using bugleweed and lemon balm extract have demonstrated anti-thyroidal effects. This is the first report of the use of these plants in the treatment of 2 patients with Graves' disease, where it led to the restoration of euthyroidism and the normalization of TSI titers. Further study at the anti-thyroidal effect of bugleweed and lemon balm is needed. However, it may be a potential treatment. You can purchase lemon balm as a tea, or you can add it to salads and many other recipes. There's some evidence to suggest that the administration of vitamins with antioxidant properties in patients with hyperthyroidism can decrease the severity of the clinical symptoms. Vitamin C is a powerful antioxidant. You can take vitamin C as liposomal vitamin C or a non-acidic vitamin C. Don't use a cheap acidic ascorbic acid. Vitamin C works synergistically with bioflavonoids. Low magnesium levels have been linked to hyperthyroidism. You can get magnesium in the form of magnesium bisglycinate. In order to determine your dose of magnesium, slowly increase it until stomach discomfort or diarrhea is noticed. Then gradually reduce until you find the maximum tolerable amount of magnesium that you can take each day. As magnesium is required by hundreds of enzymes in the body, you may experience some profound results after a few months of supplementation. Another mineral that's also required for the proper functioning of hundreds of enzymes is zinc. Low levels of zinc have been observed in people with Graves' disease, as well as an increase in zinc excretion. A more accurate way to test for zinc is by testing red blood cell content rather than serum levels. Recommended doses of zinc range from 30 to 50 milligrams per day. Check the absorption of the various forms of zinc, as some can have low bioavailability, as low as 20%, meaning a much higher dose is required in order to achieve the amount recommended. Eye problems, known as thyroid eye disease, affect around 1 in 3 people with an overactive thyroid, which is caused by Graves' disease. Problems can include eyes feeling dry and gritty and sensitive to light. One of the most advanced eye formulations developed that contains lubricants together with a unique antioxidant called N-acetylcarnosine is called Can-C eye drops, and these are proven to soothe and rejuvenate tired eyes, helping with macular degeneration, cataracts, and other age-related eye disorders. This could be very effective in the treatment to help protect your eyes from thyroid disease. Omega-7 from sea buckthorn and astaxanthin are also very good supplements to help protect the eyes. For those with hyperthyroidism who are highly stressed and strung out, herbs that have relaxing properties may help, like ashwagandha, chamomile, passion flower, valerian, and rhodiola. These may all help to calm the body and the mind. Romania would also provide additional support to the adrenals, reduce inflammation, and help modulate an unbalanced immune system. A B complex that includes all the B vitamins will help to support the body during times of physical and mental stress, and they also play a role in relieving anxiety and nervous tension. Feeling exhausted is a common complaint of people with Graves' disease, and supplementing with the B complex may help to relieve this exhaustion and provide additional support also. Vitamin A is vital for healthy thyroid function, and a deficiency is common in people with thyroid disorders. In one study, the serum levels of vitamin A was significantly reduced in people with both over and underactive thyroid disorders. If you have hyperthyroidism, there's a good chance that you have a vitamin B12 deficiency. A vitamin B12 deficiency can lead to you feeling fatigued, weak, and dizzy. Be aware that a blood test can miss a B12 deficiency, as food is now fortified with folic acid, and this can mess with the reading of the blood test. If you can't get B12 injections, get a sublingual methylcobalamin powder for the best absorption. In a randomized trial, it was shown that 2 to 4 grams a day of oral L-carnitine was capable of reversing hyperthyroid symptoms and biological changes in the hyperthyroid direction, as well as preventing or minimizing the appearance of hyperthyroid symptoms. Iron is a nutrient that's important for normal bodily processes, including thyroid health. Iron helps the red blood cells carry oxygen to other cells in the body. Researchers have linked low levels of iron to hyperthyroidism. Only consume food-sourced iron, as synthetic iron supplements have been linked to health problems. Findings show that hyperthyroidism increases the components of the antioxidant system in the erythrocytes, and furthermore, vitamin E supplementation reduces this burden of oxidative stress in hyperthyroidism. You want to get a food-based mixed tocopherol form of vitamin E supplement for best results. Present findings reveal that omega-3 has encouraging therapeutic effects against hyperthyroidism-induced hepatic dysfunction. These effects of omega-3s are attributable to more than one mechanism. Its antioxidant, anti-inflammatory, and anti-fibrotic effects. Doses can range from 3 to 9 grams per day of a molecularly distilled EPA-DHA fish oil blend. Turmeric may reduce the frequency of thyroid disease. Studies have linked certain spices, including turmeric and green chilies, to reduced frequency of thyroid disease, including hyperthyroidism. Common doses of curcumin, the turmeric extract, range from 2 to 5 grams per day. As curcumin has low absorption, it's enhanced by taking it with biopterin, which is a black pepper extract, or by eating it with an oil like butter, ghee, coconut oil, or fish oil. Glutathione, known as the body's master antioxidant. Glutathione recycling helps balance immune function, and it shields thyroid tissues from inflammation and autoimmune attacks. Glutathione also helps repair damaged tissues, such as in the case of leaky gut. Some ways to increase your glutathione levels are by taking reduced glutathione at up to 1 gram per day, taking N-acetylcysteine at 500 milligrams 3 times per day, take the herb milk thistle or eat asparagus, and also ensure that you have your daily dose of selenium. Finally, folate. Folic acid is affected by thyroid dysfunction, as hyperthyroidism is associated with subclinical deficiency and depletion of folate stores. You only want to take folate in the form of 5-methyl tetrahydrofolate,